If you're a healthcare provider tired of offering one-off visits that don't lead to real results, this video is for you. By the end of this video, you'll know exactly how to structure customized care plans that not only serve your patients better, but also protect your time and energy and your business. And stick around because I'll share the exact strategy I use to turn hesitant patients into committed clients without lowering my prices. I'm Dr. Zac Watkins, and after years of trial and error in functional medicine, I've learned how to build care plans that get better outcomes, create consistent revenue, and make your work more fulfilling. We're going to talk through customizing plans for individual clients or patients. And I come at this from a place of past experience and trial and error and things I've done through over time. So I started out, I gave you a lot of stories of me because I hope that some of these stories resonate with you. And I know this is common in the industry, but I always started out with transactional care, basically is what I called it. It was kind of like a medical visit. It's like you'd come in, the patient would pay their consultation fee, they'd pay for maybe their follow-up and things like that. So that was the mode of my practicing for a while because that's all I knew. That's what I was taught. That's what other people told me to do. That's what I thought in my head. Hey, I'm a provider, so this is how you do it. They come to me, you do your visit, and then you charge and go away. But we know, what we all know is that functional medicine is a broader picture. I always tell people, don't lead so much by symptoms. Medicine does a great job at that, typically, but we don't, from a functional medicine perspective, we can't just chase symptoms for the testing we're going to be doing. What I also mean by that is symptoms can be misleading and lack of symptoms can be misleading when it comes to your nutrition. And I think when patients get that, they understand that, it makes your testing and your follow-up and your plans make more sense to them. And so there's lots of benefits of doing more of a customized plan, bundled care plan for patients. One of them is protecting you, the provider. You front load your business with income, and that helps always because money in the door quicker is helpful to keep the train running, keep your business going, pay for expenses and things like that. And even if there's payment plans, which we'll get down in kind of the pricing, it gives you that kind of recurring, what's called a monthly recurring revenue, MRR. And that's always gold mine. I try to get providers somehow figure out how you can get a monthly recurring revenue, because then now not only does it protect you as a business owner in terms of consistent revenue production and prediction, it also makes your business more valuable. So if you want to even sell your business someday or bring on a partner to buy you out, it's going to be more valuable. Anyway, we'll get that's in the pricing care side of things. But I learned this, that I had a mentor tell me once, you don't really go into a Mercedes lot and you kind of look at the thing and it's beautiful and gorgeous, but then you say, you know what, I only want to buy like the air filter, and I only want to buy the exhaust pipe, and I only want to buy maybe this beautiful driver's seat, and that's it. You want the whole package. You want the package of the car. You want the way it makes you feel. And that kind of analogy is to go along to say, this is what we do. And when patients come into this, they're looking for a solution. They're not looking for maybe the visit and all that stuff. They're looking for the solution of their problem, of their symptom, of their condition, whatever it may be. And we have that solution. And now it just comes down to presenting that in a way that says, okay, I see where you want to go. Here's how I'm going to support you in that. And we're going to do some testing. We're going to do some follow-up. We want to guide you through your dietary care plan, whether it be health coaches or you. We're going to do some follow-up in-office testing, whatever you do for your modality. And then we want to maybe touch base at the end and do a little follow-up testing. When I did that, and this is again from experience, when I did that, you're lowering that kind of wall that people don't trust. Again, I'll say it again, that trust factor is very low right now. So when you can just lay out what they expect, what they're going to expect being with you, they seem more bought in and they're okay with that. And we experimented with this. I remember taking patients out on a focus group where I paid for dinner, asked questions. I said, what could make your experience better? And none of it was around pricing. Like no one says, I want cheaper price. Actually, we had a few people, we had a kind of an answer to a question that says, would you pay more if you knew what you were getting ahead of time? And that was a resounding yes. Patients would say, I'd gladly pay you more, only as long as I knew what I was getting. So we took away from that when we did a little of a focus group. It was that they liked coming in for the services, but if they weren't quite sure what they were getting down the road, they were very hesitant to keep paying. Hey, real quick, if you're listening to this and thinking, I need some help building out something like this in my own practice, well, just scroll down and click the first link in the description. You can book a free strategy call with myself or my team, and we're going to take a look at what you're doing now, where you're stuck, and show you exactly how to build a customized care plan that works for both your patients and your business. All right, back to the video. And to keep, coming, because they just had that fear in their head of, I got to keep buying, I got to keep whipping out credit card. And this went for, it doesn't matter about income levels or all that stuff. I saw CEOs of $100 million businesses and they still didn't like that nitpicky stuff. So I would say, behooves you to connect with your patient and build what you think they will need. Pretend this is like your family. What would you want them to do over the next 3 to 4 months or however long your care plans are? What would you want them to do? What's that look like? Well, I want my dietary team to follow up with you once a week. I want you to have access to our back end portal where you can message and ask questions. I want you to have priority access to when you call the office. We want maybe a $200 credit per month for nutritional medicines. Whatever that is for you. And I think if you think it from their perspective of who's your ideal client, patient, what do they struggle with? What are their problems? What are the things they fear? And why would it be a hang up for them working with you? And then just come up with a solution. That's your offering. It's not like I serve Hashimoto patients and you're going to do the testing and treat it more like a medical transaction. Where I think we started to win, where I see other practitioners win, is saying, okay, we're dealing with a thing, the Hashimoto's or autoimmunity, whatever it is. What would I want? What do I know in my heart? If I had autoimmunity, my wife had autoimmunity, what am I doing for her? I'm looking at her gut. I'm looking at her diet to see which foods are causing problems. Maybe looking at some more detailed vitamin testing. I'm looking at a leaky gut. What's the damage there? How's that being improved? Or where's the damage? I'm looking at, what kind of nutrition we can do for her over the next 3 months on a predictable manner. And I would say, dear, this is what we're doing the next 3 months. And here's the steps and here's the plan. So I'm a big believer and fan of this. I tell my clients I work with to do this. You're going to get more follow through. People don't buy a big expensive car and just let it sit in the garage. Usually they're going to drive it and love it. So like your care plan, they're going to use it. They're going to show up. They're going to be consistent. Now, that's not everybody. I get that. But at the same time, when you lower, again, this whole thing is like a trust exercise. Once you lower that barrier to get them to trust you, they will follow through with their plan. They will get better, which is the goal, and they will refer, which is good too. So this is not a way to get more money from people. This is not a way to say, how can we jack up our prices, all that kind of stuff. This is a way I know of other providers I've worked with have found that you are just being honest with them and saying, I know how to get you well. Of course, the work's on you, but here's what you can expect. Patients respect that. And I think they really like it. And when they respect it and they like it, they're going to work with you a lot more. So consider customizing plans for your patients. And it can be all over the board. I have people do month-long plans. I have people do year-long plans. Me personally, we always had 3-month plans. That was like our sweet spot. And we can discuss this more. Just, type in more questions if you need some clarity. This is kind of an overview that goes deeper, just like this whole section. There's different areas that go deeper. But I just encourage some thoughts, some postings. And also, we're going to be sure to maybe cover some of these things on our calls. So, but in the meantime, start thinking about that, what you currently do. And maybe how can you build a program or protocol for your patients. And this goes for medical doctors, chiropractors, acupuncturists, whatever background we have, because this is not about you or your degree. This is about your patient and how you can get them well. Hey, before you go, make sure to hit that subscribe button so you never miss a video. If you like this one, you're definitely going to like the next video. So click here on the screen, keep going, and I'll see you over there.